Assalamu alaikum. My name is Dr. Jabeerah. I'm one of the mentor of MedPrep Online, and I'm mentoring MRCPCH Part 1. And today I have bring a very important topic of FOP and TAS exam, which is type of inheritance and pedigree charting. So usually pedigree charting is coming in TAS exam. Okay, and the type of inheritance have different type of questions which are mostly coming in FOP exam. Okay, so we are going to discuss the topics first, the type of inheritance regarding their risk of inheritance to the children. And then on the side, we are going to solve some of the important questions which might have, confusion in your mind regarding that. So we are going to solve them as well. And then coming to the pedigree charting, so it's mostly included in TAS exam. And obviously when you see recall, so you do not have any chart in that, and nothing is there. Okay, so we are going to discuss the approach of it, and then we are going to solve some examples. All right, so just listen to me carefully, and then I hope that you will interact with me and give the questions, answer to the questions. All right, so let's get started. um let me see how many people we have. Okay, so we have few students. Well, I hope student will join in later, so we can start. Okay, so first question, first topic is type of inheritance, and we know that we have different type of inheritances. The most important four types are these, which is autosomal dominant, autosomal recessive, X-linked recessive, and X-linked dominant. Okay, so among these, if we talk about FOP exam, so the above three is very important in sense of their risk of inheritance to the offsprings. All right, so we are going to do that thing, that if mother is affected or if father is affected, then what will be the risk of inheritance of the children. All right, so each of one thing is have a different type of criterias to discuss. So we are going to discuss this and that. All right. So first is autosomal dominant inheritance. Now, what is autosomal dominant inheritance is? Okay, so when we talk about our genes, okay, so if we talk about most of the people could have known this, okay, but those those do not have information regarding this. So suppose if there is a girl, okay, so if when there is a girl, when we talk about girl, so girl is have chromosome X and X. Okay, and when we talk about boys, okay, so boys have X and Y. All right, okay, so they have two chromosomes over here and they have two chromosomes over here. So this is for girl and this is for boy. When we talk about autosomal dominant inheritance, what does it mean? It means that in two genes or in two chromosome, if one is affected, okay, then the disease will occur. Okay, same with here also. If in from both of them, okay, if one is affected, then disease will occur. Obviously we know that these two has achieved from where. Okay, so these two have gotten from father and mother. Okay, one from father and one from mother. All right, so that means if one of the parent is affected, okay, so the gene will come over here, and if only one gene is affected in autosomal dominant inheritance, then that it will cause the disease. All right, so this is the pattern of inheritance in autosomal dominant, in which one gene or one parent is affected, that would be enough to get the disease to the child. All right, so this is the overview of the autosomal dominant inheritance. When we talk about autosomal recessive inheritance, that is different. That requires two gene mutation. That means that the gene mutation should be from the father also, and the gene mutation should be from the mother as well. Okay, when we get two gene mutation both the side, then we will say that yes, now this is disease. Okay, now coming back to our topic, which is autosomal dominant inheritance. So monoallele, alteration in only one copy of gene pair, that can cause disease, which I have explained you. Males and females are equally affected in them. Now the question is, which they ask in FOP exam, that they give you certain questions, okay, in which they show you certain type of disease, and you should know that either it is autosomal recessive or autosomal dominant, and then you have to answer accordingly. So when we talk about the example of autosomal dominant disorders, so we have achondroplasia, familial hypercholesterolemia, Huntington disease, Marfan syndrome, myotonic dystrophy, neurofibromatosis, Noonan syndrome, osteogenesis imperfecta, autosclerosis, polyposis coli, and tuberous sclerosis. Now these are taken from the book, which is illustrated textbook. It's given in the textbook. Okay, so the most important one they usually ask in autosomal dominant is the Marfan syndrome. They ask you about the osteogenesis imperfecta. Okay, so neurofibromatosis. So these are some common questions they can ask you regarding it. All right. Now coming to it, inheritance. When they talk about certain disease, they give you certain disease which is autosomal dominant. Okay, and then they ask you that what will happen if father is affected, okay, and mother is unaffected, or you can say like neither carrier or not affected. So you can see over here, mother is XX and does not have any genetic mutation. Neither she is a carrier, okay, neither she is affected. And obviously, in autosomal dominant, we don't have any carrier. Either they are affected or they are unaffected. So mother is unaffected, XX, okay. And when we talk about father, so father is affected. That means it has one gene mutation which is on X. So you can see X is mutated and then Y. All right, now how you will take out the inheritance? All right, how you are going to take out the, you are going to make the crosses, and it's very important for you to know how to make the crosses, because whenever such question comes, okay, it definitely you will be having a pencil and a paper with you. Okay, you are going to make the father inheritance, you are going to make the mother, and then you're going to make the crosses, and then what will come out? So see, for example, we have affected father, we have unaffected mother. Now you're going to make cross, so from X, okay, to this X you're going to make, and what you will get? So one mutated gene and one you will get non-mutated gene. So again, what you will see here, that even if one gene is affected, this will be diseased. Okay, so this is affected. Now again, this X with another X, so X mutated and then X, so you can see two of them we are having affected. And then obviously we are done with this, then we are going to make the cross with this one. So from Y to X, so XY, you can see no gene mutation is there, and again XY, you see there is no gene mutation over here. So you will see in the last, what you will see, that 50% of them, like among four of them, two are unaffected, that is 50% of four. So 50% are unaffected and 50% are affected. All right, so this way you're going to answer if they ask you about the risk of inheritance. So when we talk about autosomal dominant inheritance, each child has 50% risk of recurrence, or you can say of occurrence. All right, so 50% will be affected. All right, 50% offspring will be affected and 50% normal. So simple, autosomal dominant inheritance is very simple. Okay, so there will be a 50-50% chances. Half of them will be normal and half of them will be affected. All right, so I hope you have understand this. If you have any question, you can message me in the chat box and then I can reply you, or you can simply open your mic and ask me. All right, so this is how you're going to take out the risk of inheritance for the children. Next, we have the type of expressivity. When we talk about autosomal dominant or autosomal recessive inheritance, we have certain conditions, okay, which is known as the variable expressivity, non-penetrance, incomplete penetrance, or de novo mutation. So there are type of inheritances in autosomal inheritance. This is important for exam question because they can ask you. There are some definitions which is also given in SOP and which is also given in illustrated pediatric textbook. Okay, there are some difference between both of them, but let me tell you this one. Okay, so variable expressivity. What do you mean by variable expressivity? So affected individual may be mild and other offspring could be severe due to variation of the genes. So we know that if autosomal, we are talking about the autosomal dominant inheritance, so half of the children will be affected and half of the children will be non-affected. Now among those who are affected, okay, some will have some features and other will have severe features. For example, if I give you the example of Marfan syndrome, okay, so two children has Marfan syndrome in a family, but one has only tall stature, suppose it's just example, and other child doesn't have, like, has more severe forms like long digits, long legs, okay, have cardiac problems, okay. So this is, you can say one is mildly affected and other is severely affected. Now this is known as the variable expressivity. All right, so this is variable expressivity. Now what is non-penetrance? So non-penetrance means that mutation is there, okay, genetic mutation is there, but they are not showing any sign and symptoms. So individuals which are having the genetic mutation but does not have any sign and symptoms, that means there is non-penetrance. So this is known as non-penetrance. Another thing is the incomplete penetrance. What is incomplete penetrance? Incomplete penetrance is somewhat like both of them, but sometimes genetic mutation expresses the symptoms and sometimes not within the population. So that means that sometimes genetic mutation is there but symptoms are there, sometimes genetic mutation is there but symptoms are not are there, okay. So in some individuals there will be symptoms and in some individual there will be no symptoms, okay. So it's just like non-penetrance, but in incomplete penetrance we will be having symptoms as well. In non-penetrance we won't be having any symptoms, okay. So for example, autosclerosis. So autosclerosis, 40% of the people who are with autosclerosis show symptoms, and 40% of them which have genetic mutation in them but they do not come up with the symptoms, okay. So this is a type of example related to this. Then we have de novo mutation. De novo mutation is a new mutation, like there is no relation of the offsprings. That means that parents are not affected but childrens are affected. So new mutation without parental history, example 80% of achondroplasia. So usually achondroplasia, 80% of them has a de novo mutation. That means parents are not affected, the disease does not inherited from the family, okay. The parents are not affected, the family is not affected, and so this is known as the de novo mutation and doesn't have affected parents but may transfer to offspring. So these are four type of you can say the definitions. Now we are going to apply this on a type of question which was given in the exam, which is TAS October 2020. All right, so read the question and tell me what could be the answer. Okay. So Marfan syndrome case, which is, a long baby in which mother and son both have the disease, but different symptoms. Son has the mutation, but normal phenotype. What is the explanation? So suppose I am talking about the son, okay, so that son has the mutation but he is normal phenotype. How you will explain this, that what type of expression he is showing in the son? So if anyone can answer me that. Anyone?
It's non-penetrance.
Yes, it's non-penetrance. Very good. So it's non-penetrance. All right. So because why? Because when they are asking about sun, all right, so you have to see that what happening to the sun. So sun has the mutation, but normal phenotype. So that means they're talking about non-penetrance. But when they talk about like the children who have different severity, okay, that will be a varial expression. And incomplete penetrance will be that some will be showing the symptoms and some will not be showing the symptoms. That will be the whole scenario they will be talking about. So depend in the stem that about what they are talking about, okay. So this is the type of question related to this. So I tried my best to put some tricky questions so that you can have a clear concept of it, because side by side to the recalls, when you study with the recalls, so it's more easier to understand the topic. And this is the way how we provide our course as well, that we do the lectures which include all the theory and the concepts, and then we have provided the recalls videos in which we have explained each and every question in quiet details. All right, so let's move on to another topic, and we have autosomal recessive inheritance. Okay, so autosomal recessive inheritance. So in the first slide, when I was explaining about the chromosomes and the genetic mutations, so when we talk about autosomal recessive inheritance, so when we talk about females, so they have two, and when we about males, so we have XY. Okay, now in autosomal recessive inheritance, if there is one genetic mutation only, suppose in X, or you can say suppose in Y, so the child will not be affected, will not come with the symptoms. All right, in autosomal recessive inheritance, it is important for both of the chromosome or genes to be affected. So two gene mutation should be there to be affected. If only one genetic mutation is there, then what will happen, that they will be called as a carrier. Okay, so that means suppose if only one genetic mutation is there and the disease type is the autosomal recessive disorder, so that means that this is a carrier, not disease. So carrier means that they have a genetic mutation in them, but they do not have the symptoms, but they are able to pass the disease to their offsprings. All right, so this is about the autosomal recessive inheritance. Autosomal recessive carrier, only one copy of gene pair is affected, carries gene but do not have symptoms or disease. Autosomal recessive affected, both copy of gene pair is affected, show symptoms. That what I explained to you. Now, what are the example of the autosomal recessive disorders? Now, this is taken from the illustrated textbook again, and there are some important ones which I'm going to mention in tick box over here, which they usually ask. So, AR, which is autosomal recessive disorders, are the congenital adrenal hyperplasia, cystic fibrosis, Friedreich ataxia, galactosemia, glycogen storage disease, Hurler syndrome, oculocutaneous albinism, phenylketonuria, sickle cell disease, Tay-Sachs disease, thalassemia, Werdnig-Hoffman disease. Now, in these, okay, they could ask you SMA, which is a spinal muscular atrophy. The most common is the thalassemia. Okay, then we have the sickle cell disease. They can ask you about cystic fibrosis, which is very important. Okay, so these are some of the important ones they can ask you. And if you go through the recalls, you will be coming up with more, if anything else they are talking about. So usually they, roam around these type of topics. All right, so you should know which one are the autosomal recessive disorders and which one are the autosomal dominant disorders. They won't tell you this, that whether they are asking about the autosomal recessive disease or whether they are asking about the or autosomal dominant. Okay, so you should know that which one is what. All right, so in autosomal recessive inheritance, they can affect both females and males. Similarly to the dominant, we did that they can be incomplete penetrance, non-penetrance, or de novo mutation. Now coming to the different type of inheritances, where we have mother or father being a carrier, one being a carrier and another non-affected, or both of them affected. Okay, so there are some you can say conditions, and according to that we are going to discuss that what is the risk of inheritance in each of them. Now this is very important for FOP exam. You're going to get these type of questions in FOP exam. All right, so I have put some questions as well. Okay, so go through this with me and then try to answer me related to question. All right, so when both parents are carrier, what will happen? So if you see over here, when both parents are affected, sorry, when both parents are carrier, what is going to happen? So mother is a carrier. So you can see over here XX, but only one genetic mutation is there. That means she's a carrier. Father is a carrier. So again, only one genetic mutation is there. When you do the crosses, what will happen? So when you make the cross like this, so you can see X mutated, so we get one affected. Okay, because both the gene mutation is there. And then again we are going to make sorry, yeah, so again we are going to make the cross with the Y one. What will happen? So one genetic mutation, okay, and Y will be here. Okay, so again another one, with the another one you are going to make. So again you can see we will be getting a carrier. Okay, then again you're going to make. Okay, so what you will see over here is that in the end, we are going to get 25% affected, 50% carrier, and 25% normal. So among four, one will be normal, one will be affected, and 50% of the will be carrier. Okay, so carrier means only one genetic mutation is there, affected means two genetic mutation is there, and no genetic mutation, that they will be completely normal, no carrier, no affected. Okay, so this is how you're going to take out. All right, so when the exam questions come, they will mention you that whether the parents are carrier, whether the parents are affected, and then they will ask that what will be the inheritance then. Okay, so in case where mother and father both are carrier, okay, 50% carriers, 25% affected, 25% normal. Okay, so this is the case of inheritance. Now the question comes, they usually ask this in the exam, that what will be the risk of inheritance for the each child, okay, to get affected. Or they can ask you what will be the risk of inheritance for each child, or sorry, risk of inheritance of a sibling. Okay, like one child is already affected, and then what will be the risk of inheritance of another child to be affected. Okay, so whenever we talk about the affected child, the risk of inheritance will always be remain 1 by 4. Okay, so then each child has 25% risk of inheritance, that is 1 by 4. Okay, now the different thing is when they talk about the carrier and unaffected. Okay, so when the question comes, suppose that a child is, suppose for example, child is affected with the cystic fibrosis. Okay, and what will be the risk of inheritance for a carrier of the sibling. Okay, so in that case, what you're going to do, now see the risk of inheritance over here. Now suppose that 25% already, they are talking that the sibling has already disease, so we are going to not talk about this one. Okay, we are going to talk about the remaining one. Among these, okay, among three, how many will be a carrier? So two will be a carrier, so the risk will be 2 by 3. Okay, so this is very tricky, but very important, because usually they ask you about such questions. Okay, and if they talk you about that affected child is there with a cystic fibrosis, and what is the risk of inheritance to be normal. Okay, so that will be 1 by 3. Okay, because among three, one will be normal, so 1 by 3 will be the answer. So 2/3 risk of sibling of affected to be a carrier, 1/3 risk of sibling of affected to be unaffected. Okay, so this is how you're going to take out the inheritance. Now, coming to the question, two type of questions are there, which I explained you in previous slide. Okay, so what is the chance? Now read carefully. Okay, what is the chance of a healthy mother and father? Okay, obviously, if they're talking about healthy mother and father, so that means they are not affected, but they could be a carrier. Okay, because they have a sickle cell child, who have a sickle cell child to have another affected sibling. Okay, so what do you think is the answer over here? What is the chance of a healthy mother and father? That means they could be a carrier who have a sickle cell child. So already affected child is there, have another affected sibling. So they are talking about affected. Okay, so what will be the answer over here? What do you think?
1/3.
No, 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 1 by 3. Okay, Dr. Gafran has answered me is 1 by 4. Okay, anyone else want to answer? Okay, so 1 by 4 is the correct answer over here. Okay, so it's a bit tricky actually, as I told you in the previous slide. Okay, that when we talk about affected child, okay, for affected child, we always have the risk of 1/4. And now, why is that? All right. So if we apply the rule which I told you, that that one child is already affected, okay, and then we are going to see among three how many will be affected. So you can see if we have four children, okay, one is already affected, so nobody will be more affected. That means one will be normal, others will be carrier. Okay, still if we have, if the child has another, more siblings, okay, then what will be the risk? So always the risk remain 1 by 4 to be affected. Okay, so this is the answer over here. 1 by 4 will be for the affected. Another question, what is the chance of a healthy appearing sibling of a cystic fibrosis child to be a carrier? Now, in this question, they are talking about a carrier. Okay. So, what is the child of a healthy appearing sibling, the sibling which is healthy, okay, of a cystic fibrosis child to be a carrier? Okay. Anyone else want to reply
2
me?
by 3. 2 by 3.
How 2 by 3? Okay. Yeah, 2 by 3. And anyone else want to answer?
Can get
Okay. Yes. So the answer will be 2 by 3. Okay. Somebody have a, yeah. So answer will be 2 by 3. Okay. So again, coming back to the previous slide, we see over here. All right, so you can see over here, one child is already affected. Okay, and again, we are going to apply the same rule that we are going to see among three, how many will be a carrier. So carrier will be 2 by 3. If they ask you about unaffected, okay, then you will answer 1 by 3. All right, so this is how you're going to answer in this type of questions.
Excuse me.
Yes.
When we talk about the carrier and unaffected child, then we said that there should
Y- Dr.
be
Hamna, your voice
2
is
by
breaking.
3 and 1 by 3. Why would
Yes.
take here the total child
Dr.
and
Hamna, I'm not able to hear
4
you.
means we should take here. I'm talking about the carrier and unaffected. Okay, I will
No, I
question in
got
the
you. I
end of the
got
session.
you. I got your question. I got your question. The thing
Yeah.
is this, okay? The thing is this that when we talk about carrier and unaffected, okay, so we are applying this rule. All right. Okay, so suppose if we apply the same rule for the affected child, all right. So what we will do that one child is already affected. So we are going to remove this, and then we are going to talk about among three of them. So you can see over here that we do not have anyone over here, right? But the risk of inheritance for the autosomal recessive being affected remains always 1 by 4. Okay, so this is the thing that 1 by 4 risk of inheritance for the affected remains the same. All right. Okay. Okay, next condition is when the father is affected and mother is a carrier, or you can do vice versa as well, that mother is affected or father is a carrier. It will remain same. All right, so what will happen? Okay, father is affected, that means they have two genetic mutation. Mother is a carrier, have one genetic mutation. When do the crosses? Okay, I'm not going to explain again the crosses because I have explained in 2 slides. Okay, so what will be the answer? Okay, what we will get? We will get two genetic mutation, one genetic mutation, one genetic mutation. What we are getting? We are getting 50% affected, we are getting 50% carriers. Okay, so whenever the question comes with one father, like one person is affected and one is a carrier, okay, and if they ask you about that, how many carriers will be there or how many percentage of affected will be there, so the answer will be that 50% will be affected and 50% will be carrier, and the risk of inheritance remain 50%. Okay, for each child. All right, so this is for the father affected and mother carrier. All right, let me see if I have put some question related to this. Yes, so father with sickle cell disease, all right, and mother do not know her state. Okay, let's suppose maternal grandfather died from sickle cell crisis. What is the chance of her daughter to be a carrier? Okay, so what do you think the answer would be over here? So here basically father is with sickle cell disease. So sickle cell disease is the autosomal recessive disorder. All right, and mother does not know her state, but grandfather died from sickle cell crisis. So we suspect that mother is a carrier. All right. So I'm making a bit easier for you. So suppose mother is a carrier and father is affected, And now they are asking, what is the chance of a daughter to be a carrier? Now, what will be the chance of the daughter to be a carrier? It's very simple. When you know that sickle cell is autosomal recessive disorder, and know you know the inheritance of sickle cell mother or father, then it's very easy to answer. Okay, 50%. 50%. Yes, exactly. Very easy. Okay, so draw the crosses. This is the father who is affected. Okay, this is the mother who is a carrier. So you are going to draw the crosses. Okay, what you will get two genetic mutations. Okay, and then you will get two carriers, and so you will see that 50% are affected and 50% will be carriers, so answer will be 50%. So it's very simple. Okay. Okay, now jumping towards another condition is when one parent is affected and one neither carrier or nor affected. Okay, that means suppose mother is affected having two genetic mutation, father is completely normal, neither carrier or nor affected. What will happen in that case? Now let's see the crosses. Okay, so X to the X, so one gene mutation, X X to the Y, one gene mutation. Okay, then X to X is one gene mutation, X to Y, one gene mutation. So you can simply see over here, because when we talk about autosomal recessive inheritance, we need two gene mutation, one from the father and one from the mother. But father doesn't have any mutation. So where the second mutation will come from? Okay, there will be no second mutation in any child, so that means each child will be a carrier and can't have any disease. So this is one of the question in the exam as well. Okay, so 0% chance of having disease and 100% will be a carrier. So all the children will be carrier. That means that the genetic mutation will come from the mother side. Okay, but father doesn't have any mutation, so obviously second genetic mutation will not be there, so all will become a carrier. And when they talk about the affected child, so obviously 0% affected, so 0% chances of having the disease. Okay, and 100% will be a carrier. Okay, so it's very simple. Now the question which comes, African mother, known sickle cell disease. Okay, father is not carrier, not affected, what is the risk of inheritance? So simply we are going to apply the same thing which we discussed, that mother is known sickle cell, that means affected, father is not carrier, not affected, what is the risk for the babies? So tell me, what will be the risk for the babies? Different type of things are given, affected, carrier. So tell me, what will be the answer over here? 100% will be carrier. Yes, 100% will be a carrier. Okay, when we talk about affected, so 100% affected won't be there, 50% affected won't be there, this will be zero. Okay, and the answer will be 100% will be a carrier. So every time you get this type of question, just make the crosses and answer. All right. Next is, okay, so I hope you understand about the autosomal recessive inheritance. Now we are going to do about X-linked disease. Yes, 100% carrier. Okay. Now we are going to do about X-linked recessive inheritance. Now, X-linked inheritance is when we talk about X-linked recessive inheritance, that means the disease will occur when there will be mutation in the X chromosome. Okay, now there is a difference in autosomal recessive and X-linked recessive. In X-linked recessive, only boys are affected. Okay, why is that so? Okay, because what happens when we talk about females? Okay, if suppose one genetic mutation is there over here, now it has another chromosome to compensate. Okay, so female remains carrier always. All right, and when we talk about boys, okay, so suppose one genetic mutation is there in X chromosome, okay, it doesn't have any compensating X chromosome, okay, so always males remain affected. Okay, so whenever you get the disease which are X-linked recessive inheritance or X-linked disorders, okay, so females remain carrier, okay, and males remain affected. It's always like this. So it is caused by alteration of the gene on X chromosomes. Females are carrier, have extra X chromosomes to compensate. So some of them show symptoms, but milder, but mostly are carriers. Males are affected, does not have X chromosomes to compensate, so they are affected. Healthy carrier females transmit the disease to their sons. There is no male to male transmission. Why? Now these two points are very important. Now see, as they are carrier, they are not affecting, but when they there is fertilization occurring, and when you make the crosses, so always female give their eggs. Okay, so whatever eggs they are giving, all right, what will happen that the genes they are providing is the X, and it will contribute to the males. So mother can pass on the disease, but male cannot pass on the disease. Why? Because genetic mutation is on the X. All right, male can pass on the disease to the females only. All right, not the males, because in when suppose if father has XY and they are contributing for the male, okay, so they are going to give their Y actually. Okay, and Y doesn't have any mutation in them, so that is why they are unable to transmit the disease to the boys. Okay, so there is no male to male transmission, but carrier females can transmit their disease to the son. Now important example of the X-linked recessive disorders are, we have color blindness, Duchenne and Bacchus muscular dystrophy, very, very important. Okay, Fragile X syndrome, very important. Glucose 6 phosphate dehydrogenase deficiency, hemophilia A and B, very, very important. They usually use this type of conditions. Hunter syndrome, mucopolysaccharidosis, number two. Okay, so those I have ticked. Okay, these are important for exam. They usually use these types of conditions. Okay, now condition, if mother is a carrier and father is healthy, what will happen? So if mother is a carrier and have a X genetic mutation, and when we make the crosses, father is normal. Okay, so you see what will happen. Okay, so when we do this cross, so we are going to get XX. Okay, so this is a female and have one genetic mutation. This is a carrier. All right. Then we have XY. So again, we have genetic mutation, but this is a male. Okay, so that means the male has one genetic mutation. No X chromosome is there for the compensation. And so this is a affected boy. All right. Then we have another one XX. Okay, so XX will form this XX and XY will form XY. So what you are going to get? All right, so you are going to get that among, because in X-link we talk like this, that how much percentage girls are affected and how much percentage boys are affected. Okay, so two girls are there and two boys are there. So between two girls, one is affected, one is a carrier. Okay, and because females remains carrier always in X-linked disorders, and in when you see males, okay, so from the two males only one is affected. So that means that 50% of the girls are carrier and 50% boys are affected. Okay, so mother is a carrier, father is a normal, and in such situation, each son has a 50% chance of being affected, each daughter has a 50% chance of a being a carrier. Okay, so in X-linked disorder, females remains carrier and son is basically affected. So this is how you're going to take out the inheritances. Okay, another condition, if father is affected and mother is healthy. Okay, now in this, in X-link, it's important to, we cannot do vice versa condition in this. In X-link, we need to see that whether it's a father or mother. Now, mother is healthy, doesn't have any genetic mutation, father is affected. That means father is with one mutation and Y. Now, when you do the crosses, what you will see, we are going to get two girls, okay, which are carriers. That means all the girls are carriers. All right, and then we are going to see son, okay, which are non-affected, because we know that what father is contributing its Y to the X. See, Y to the X. Okay, and you will see there is no genetic mutation in them. So 100% girls are carrier in them. So you can see the carrier state, and 0% boy is affected. So this is the inheritance when the father is affected and mother is healthy. Okay, and you are going to get 100% carriers, girls, and 0% boys. So none of the son is affected because father contributes its Y chromosome for child, and all daughters will be carrier. So usually in exam, if for the X-linked recessive, they usually don't ask you about the percentages of the risk of inheritances, but they do some tricky questions. So for example, the question we have is here. So please answer me this question, that what will be the answer of this question. Anyone? What is the chance of a father with hemophilia disease to have a affected boy? Now father is here, who is affected with hemophilia. Now hemophilia is the X-linked disorder. Now they're asking about the chance for the affected boy. Okay, so boy is affected. Now what is the chance to have a affected boy? Hmm.
It's population risk, as
Yes,
boys won't be affected.
yes, very good. Yes, so the answer will be population risk, because however father is hemophilia, okay, so he can transmit and transfer the disease as a carrier to the daughters, okay, but cannot transmit the disease to the boys. So in such cases what will happen, de novo mutations can occur, okay, and that would be related to the population risk, that whatever the population risk is there for the hemophilia disease itself to have a de novo mutation, okay, that will be a risk, okay. It will not be related to the father with the hemophilia disease. Yes, we will. Even if a mother is affected, what will be the case? Okay, they are talking about father to have the disease, affected boy. Okay, if suppose mother is a carrier, what will happen? If mother will be a carrier, okay, so he can transmit the disease, okay, but here as they haven't mentioned, okay, so how can we suspect that? So it depends that what stem they are providing, like as we have here father with a hemophilia disease to have a affected boy, then you are going to answer related to this. If mother has a disease, then yes, there is a probability to have the disease from the mother, then you are going to do the crosses and see that what will be there. Okay. Okay. Another type of inheritance is the X-linked dominant inheritance. This usually doesn't come to ask about the risk of the inheritance. Okay, this is more important for the pedigree charting. But let me go through this as well. Now, X-linked dominant inheritance is, it can affect both males and females, as only one altered copy of gene can cause disease. Okay, but as it's X-linked dominant, it will be in the X, and what will happen that males and females both can be affected. All right, affected female can pass disease to the son and daughter both. And what will be the, because as it's dominant, so what will be the risk will be 50% for each, so 50% risk for the males and 50% risk for the females. And if we are talking about affected males still can pass disease to daughters, not the son, okay, then what will happen, that when we talk about passing the disease from males to the son, then it will be obviously 0%, okay, and 100% of the daughters will be a carrier, just like we talk about in the X-linked disorders. All right, so this is the case, but usually the risk of inheritance doesn't come for the X-linked dominant inheritance in the FOP exam. So we are going to jump towards the pedigree charting. uh, okay, so do you have any question related to the type of inheritance? Whatever we did, you can ask me, then we move on towards the pedigree charting. Okay. All right. Now, first, we are going to go through the approach to predict the pedigree. Okay. In test exam, they will provide you in the question a pedigree, okay, which will look like somewhat like this. Okay. And then you have to interpret that what type of inheritance is this. All right. For this, you need a nice approach. Okay, what will be the approach? Okay, just read the approach. I'm going to make you understand the approach, and then for each type of pedigree we are going to try to sort out that which type of inheritance is this. Okay, when you talk about pedigree, so interpret whether it is dominant or recessive. All right, so how you're going to interpret that whether it is dominant or recessive disease. All right, you are going to see that one of the parent must have the disorder, there is no skip generation, and recessive, no need for affected parents present skip generation. Now let me show you the example of this, of the dominant. Suppose this. Okay, when we talk about that, we are searching that there is skip generation or not. Okay, so how you're going to see that there is a skip generation or not? So you will see that that if suppose this is the child, and then you will see parents are affected or not. Yes, parents are affected. Okay, then you will see this. Okay, the child is affected, and now you will see that the parents are affected or not. So yes, parents are affected. Over here you will see, okay, the 9 children, so parents are affected. Yes, parents are affected. Okay, for this you are going to see, yes, parents are affected. So this is how you are going to see that whether this is the recessive or dominant. Okay, or there is a skip generation or no skip generation. So here there is no skip generation. Okay, every generation is affected, that means each parents are affected. Now this is for the dominant case. All right, now when we talk about recessive, now we will see about skip generation, how you're going to predict the skip generation. Now if you see over here, this is the child is affected, but you see that the parents are not affected. That means one of them could be a carrier or both of them could be a carrier. Then you will see over here the child is affected. Okay, and you will see the parents, there is no affected. Okay, so you can get like different type of inheritance. You can get this type of also. Suppose this is the thing, this is the thing. Okay, and you have dominant type. Here you can see that there is parents are affected. Okay, so parents are affected and child is affected, but you can see there is a skip generation also. So we will consider this skip generation, that skip generations are there. So that means that this is recessive, because skip generation are there. So this is how you're going to see whether dominant or recessive. Okay, once you come to know that it's a dominant or recessive, then you are going to interpret that whether, if it is recessive, whether it is X-linked recessive or autosomal recessive. And then if you come to know that it is dominant, then you are going to interpret whether X-linked is dominant or autosomal dominant. Now how you're going to do that? Okay, if you are getting recessive, all right, in which you see there is a skip generation, then you see the affected children are only males. If they are only males, that means this is X-linked recessive, very simple. And if in recessive, okay, in skip generation you see both male and females are affected, then that means this is autosomal recessive. All right, next coming to the dominant one. Now if you see there are no skip generation, every generation is affected, every affected child has the affected parent. Okay, either it could be X-linked or it could be autosomal dominant. Unfortunately, in both of them, in X-linked dominant also and in autosomal dominant also, we have both male and female affected. That means both of them are getting both population are affected. Okay, not only male or not only female, because we are talking about X-linked dominant over here, not X-linked recessive. Now what will be the next step to differentiate between the X-linked dominant and autosomal dominant is that you are going to see in the pedigree charting that whether there is male to male transmission, that means from father to son transmission is there or not. Okay, so if there is father to son transmission is there, okay, so that means this is autosomal dominant. All right, because father to son transmission can be there in autosomal dominant. All right, and if there is no father to son transmission, okay, then that means that this is X-linked dominant. So if you focus on this approach and try to solve each pedigree, okay, that will be easier for you to answer. Okay, now let us go through some examples and we will try to solve them, and then I'm going to explain you that how you are going to interpret that. Okay, it's okay if you do not interpret correct, that's okay, we are just practicing over here. So this is the chart, and try to solve it and let me know which type of inheritance is this. Okay. Anyone else? Anyone else wants to answer? Okay. 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 Some says autosomal recessive. Most of them says saying autosomal recessive. Only few are saying autosomal dominant. Okay. Those who are saying autosomal dominant, so let me explain you. If first step of our approach is to see whether it is dominant or recessive. Okay. It's about the skip generation. So for is we have to see whether there is a skip generation or not. Yeah. Okay. So you can see over here, there is a skip generation. We do not have parents affected for the child. So that means it cannot be a dominant. Okay. This is recessive. Okay. This is recessive. Okay. And then the next approach is in the recessive, we have to see whether male and female both are affected or only males are affected. So clearly you can see over here that females are affected. Always for female, we use circle, and for males, we use a square. Okay, so square and female, that means female and males both are affected. So that means that this is the autosomal recessive inheritance. All right. So it's very easy to interpret. All right. So some points to consider of the rule of autosomal recessive inheritance, that there will be skip generation. Both males and females will be affected, and affected offsprings to unaffected parents remains carriers. Okay, so this is the some points to remember. Okay, coming to the next pedigree charting. Now try to answer me this one.
It's autosomal dominant.
Okay, anyone else want to answer? Yes. Okay. Okay, good. Now tell me why it can't be X-linked dominant. Yes. Okay, very good, Dr. Gafran. Okay. The question is why it can't be X-linked dominant. Yes. Good. Okay, so same approach we are going to apply on this. We are going to see whether parents are affected or not. So we can see that there is no skip generation. Even here you can see skip generation is not there. Even here you can see that each child has the affected parent. Okay, then the second thing you are going to see that whether males are affected or female. So we can see over here both males and females are affected. So dominant. Now either it could be X-linked dominant or it could be autosomal dominant. Okay, for that you are going to see whether there is male to male transmission or not. So here you can see that from female, males are affected. Okay, so you can see over this over here that male to male transmission is there. Their father is transmitting the disease. That means it couldn't be X-linked dominant. So yes, this is the autosomal dominant disorder. Okay, so we are done with autosomal dominant. Okay, perfect. Okay, now points to remember in the autosomal dominant inheritance, that there will be no skip generations appear in both males and females with equal frequency. One of the parent has to be affected. Affected child can be a girl or a boy. Both unaffected parent does not transmit the disease. In the end, you have to recheck, exclude X-linked the dominant. So in the end, it's very important. If you suspect that this is the autosomal dominant, you need to check whether there is male to male transmission or not. Okay, so if there is male to male transmission, then you will go with the autosomal dominant. If there is no male to male transmission, then you are going to go with the X-linked dominant. All right, now next, pedigree charting. Tell me what is this?
X-linked recessive.
Okay, anyone else want to answer? Mm-hmm. Okay. Yes, this is X-linked recessive. Okay, so the answer is correct that this is the X-linked recessive. Yes, very good. Okay, so you can see over here that each child is basically, you see that there is a skip generation. So they are carriers. So for each affected child, parents are not affected. So skip generations are there. Then you have to see only males are affected or females are affected, to make sure that whether it is the autosomal recessive or X-linked recessive. Okay, so clearly we can see that only males are affected. So when only males are affected, then this is the X-linked recessive inheritance. Okay, so yes, and no male to male transmission, obviously, just like X-linked dominant, even in X-linked recessive, male to male transmission cannot be there. All right, so this is X-linked recessive. Points to remember in X-linked recessive inheritance is skip generations. Male are affected only. Affected son born to unaffected mothers. That means the carriers only can give born to the sons. There will be no disease from father to the son. Okay, so this is some of the points to remember in X-linked recessive inheritance. Okay, next pedigree is this. Tell me which one is this. How autosomal dominant? Recheck again. Mm-hmm. Yes. Anyone else to answer? Now, those who have said autosomal dominant, it's not correct. Okay. Those who have said X-linked dominant, yes, it's correct. Okay. Now, the approach I have told you, yes, exactly. So, this is X-linked dominant. Okay. Why? Because every time I told you, whenever you suspect that this is autosomal dominant, in the end, check male to male transmission if it is there or not. All right. So, when you see that it's there, okay, then you have to go with the X-linked dominant. So again, same approach. See the skip generations, we do not have skip generations. Each child has affected parents. Okay, then either it could be X-linked dominant or it could be autosomal dominant, because in both of them male and females both are affected. So you can see both males and females are affected. Now for differentiating between autosomal dominant and X-linked dominant, we are going to see the male to male transmission. So where you are going to see, you can see over here that male parent is affected but not transferring the disease to the male. So male parent is affected but not transmitting to the disease to the male. So this is X-linked dominant case. Okay, so this is the X-linked dominant inheritance. All right, well done everybody. Okay, so points to remember in X-linked dominant inheritances, there is no skip generation. Affected son must have affected mother. Affected daughter either has affected mother or father. Affected father transmits the disease to the daughters but not the son. Affected mother transmit the disease to both sons and half daughter. All right, so this is for the X-linked dominant disorder. So these four which we did is very, very important for pedigree charting. All right. I hope you have understood well. If you feel that there is some confusion, you can ask me. Okay. And I will answer you. Next two types are mitochondrial disease and Y type of disease. Okay. So we usually do not get the pedigree for these. Okay. But you should know the type of inheritance they have. Mitochondrial disease, father doesn't transmit the disease, only mother transmit the disease. Okay. So all children will have the mutation, but some will show the symptoms and some do not. As we did in non-penetrance, or yeah, as we did in non-penetrance, that there will be some sorry, in incomplete penetrance, that some will show the disease and some will not. Okay, so all children have the mutation, but some will show symptom and some do not. That means that there will be 100% risk of being affected. Okay, but obviously as it is incomplete penetrance, so symptoms could be there or not, could not be there. So this is the, you can say, the pedigree look like. Okay, so you can see that everywhere mother is transmitting the disease. Wherever the father is affected, they are not transmitting the disease. Okay, both male and females are affected. Okay, and you can see that some of them are affected and some of them are unaffected, but it's important to know that they are unaffected because they have the mutation but symptoms are not there. Okay, so 100% children are need to be affected. So for this type of inheritance, we have a question in the exam or for the TAS exam. So baby with severe developmental delay, Lace syndrome, suppose this is the mitochondrial disease. His mother diagnosed with the mitochondrial disease. What is the incidence to have another disease baby? So as there will be every child has a tendency to get affected. So here the answer, if you everybody know, please let me know what will be the answer over here. Yes, so the answer will be 100% child will be affected. Option 1. Option 1 will be correct. Okay. Viling disease, Viling recessive. Now, I haven't seen any question related to this, but as in the books they have. So let me go through this as all as well. Unlike mitochondrial disease, the only father is there who transmits the disease to the son. Okay, daughters are neither carrier or not affected. So in the pedigree charting, you can see that there will be males affected. Okay, and male to male transmission will only be there. Okay, not male to female transmission. Okay, daughters are neither carrier and not affected. So this type of recessive violent recessive disease you are going to see. Okay, so we are done with our today's webinar. And if you have any question, you can ask me. Was it helpful or not? I hope it was helpful for you as the exam is near. So you should know all of this. Okay, thank you so much. Yes, the recordings will be available on YouTube very soon. If you have, like, if you forget anything, you can rewatch them on YouTube. Okay, so you can go through that. Okay, you're welcome. Okay, so thanks for now. Thank you so much. Thank you.